All right, so this video is going to go over the examination flow for the head and the face. First, I'm going to have the patient sit down. I'm going to have him face me. I'm going to inspect or observe the position of the head as well as the proportion in relation to the body. Next, I'm going to observe any asymmetries of the eyebrows, the eyes, the pupils, the nose, and then the mouth. And since I'm looking at his face, I'm going to palpate his parotid glands. I don't have any gloves on. I would do this with gloves on normally. So I'm palpating the parotid glands for any asymmetries such as swelling. Next, I'm going to stand up. Could you come closer to me? I would normally stand behind the patient, but I'm going to inspect the patient's scalp for any lice, any scarring or scaling. I would do that on both sides of or all around his head. Then I would proceed to palpate any masses or tenderness. No tenderness on that, right? Excellent. So once I'm done with that, you can scooch back a little bit. So once I'm done palpating, I will then listen to his temporal artery as well as orbital artery using the bell side of the stethoscope. So I'm going to place this on the side of your head, all right? Let me know if this bothers you at all. I will do the other side. You have a strong artery. Excellent. Now I'm going to have you close your eyes. You're going to feel a little pressure over your eye. I will be listening to your orbital artery, so you could lean back a little bit. There we go. Close your eye. And let's do the other side. Ready? And good. All right, so I'm done with the stethoscope. Next, I will be testing for cranial nerves. I will be using my tongue depressor here. Not yet, actually. I'll use this later. So I will be testing cranial nerves. So I will be testing for a trigeminal nerve. I will be, you can close your eyes. I'll be rubbing, lightly touching the forehead, the cheekbones, as well as the jawline. How do those feel? Do they feel the same or different?
Oh, the same.
The same? Excellent. Next, I would have a cotton swab, but we actually don't have one with us today, and we don't have gloves, so I feel like it would be unsanitary to touch the sclera of his eye or the cornea of his eye. We would see a blinking reflex when we touch the cornea of his eye with the cotton swab. Next, I will take my tongue depressor, and I will check the muscles of mastication, and I will have him bite down on one side, and I will lightly pull and tug. Excellent. Let's try the other side. All right, lightly pull and tug, and then that is the trigeminal nerve. Next, I will test the facial nerve, which would be, I would have him wrinkle his forehead, frown for me, and then smile, and then puff your cheeks up. And that would be assessing for the facial nerve, cranial nerve 7. And I believe that's it. Good job, sir.